Hello everyone, I am Dr. Shankar Dey. Welcome to 7th video of NEET-PG 2022 recall questions discussion. So coming to question number 61, which of the following condition causes intermittent breaking of long bones in a child? This is very typical presentation of one of the following disease, that is osteogenesis imperfecta. This is due to collagen formation defect. So this disease can present with intermittent breaking of long bones, not Marfan syndrome. It presents with hyperflexivity of limbs, not achondroplasia and not the cretinism. See here the X-ray of osteogenesis imperfecta. See here is another fracture, there is another fracture, here is another healed fracture. So there is multiple fracture line or healed fracture line in this bone. So osteogenesis imperfecta usually sometimes presents with triad of blue sclera. See here the blue sclera. Osteogenesis imperfecta presents with blue sclera, osseous fragility as seen in this image. So this is blue sclera and this is osseous fragility, intermittent breaking of long bone with some bony deformity and conductive hearing loss, and this triad sometimes known as Van der Weyden Klein syndrome. So Van der Weyden syndrome. So this is the question is about osteogenesis imperfecta, presence with intermittent breaking of long bones in a child. Coming to question number 62, adult patient with recurrent swelling of unilateral neck. So there is recurrent swelling of neck in one side of neck. Food intake usually increases the size of the swelling and worsen the symptom. So during food intake the symptoms usually worsens. Imaging done, it is showing some radio opaque lesions here on the oral cavity. So most likely diagnosis. So this is typical presentation of salivary gland tumor, also known as sialolithiasis or salivary gland stone, not tumor, salivary gland stone. During food intake, secretion, salivary gland secretion increases, but as there is obstruction to the salivary gland duct, there will be accumulation of secretion inside the salivary gland. It will cause more stretching and pain, so that will worsen the symptom during food intake. So this is a typical case of sialolithiasis with radiopaque lesion in orthopantogram or X-ray of the oral cavity. So this is sialolithiasis or salivary gland stone. Next, coming to the question number 63, which will be the ideal treatment for fibular fracture? As all of you know, fibula is a long slender bone in the lower limb, okay, in the leg, and just beside the neck. Suppose this is neck of the fibula, and around the neck of the fibula there is one nerve that is called common peroneal nerve, and damage to this nerve can cause foot drop. So after fibular fracture you have to do the neurological assessment to rule out any damage of common peroneal nerve. The first thing you will do during treatment of fibular fracture is neurological testing. So first is neurological testing, then give some analgesic to the patient to relieve the pain, then you should do the cast, plaster of Paris, POP cast. So this is the answer, neurological testing followed by analgesic followed by cast. Okay. Coming to the question number 64, which of the following is seen after rupture of saccular aneurysm? So saccular aneurysm rupture in vein usually causes subarachnoid hemorrhage. Okay, subarachnoid hemorrhage can be seen after rupture of saccular aneurysm. Straightforward question. Coming to the question number 65, this image is showing, as you can see, there is presence of multiple deformities in the limb. So this is definitely some disease with multiple lesions. So this is multiple enchondromatosis. So this is the image of multiple enchondromatosis, typical image. 66 number question, a 24 years old female presents with primary infertility, hysterosalpingogram done, and image has been shown. What is the diagnosis? This is the image of septate uterus. This is the image of septate uterus. Here is the various uterine deformity. This is unicornuate, this is septate, this is bicornuate, this is uterine didelphus, and this is uterine didelphus. So here you can see the various. This is normal, this is unicornuate uterus, this is uterine didelphus, this is bicornuate, this is septate, and these are the hysterosalpingogram. So the question asked about septate uterus. Coming to question number 67, most common complication of untreated radial head dislocation. Is it cubitus varus? No. It is cubitus valgus? Yes. Most common complication following untreated radial head dislocation is cubitus valgus. Cubitus varus is usually seen with after untreated supracondylar fracture of humerus. Supracondylar fracture of humerus, not the ulnar nerve damage, not also myositis ossificans. Coming to the question number 68, a depressed patient ingests large amount of tricyclic antidepressant. What is the drug of choice for tricyclic antidepressant poisoning? Straightforward question. The answer will be, what will be the answer? Sodium bicarbonate. Sodium bicarbonate is the drug of choice for tricyclic antidepressant poisoning. NaHCO3. NaHCO3 has been shown to reverse the QRS widening hypotension arrhythmia associated with tricyclic antidepressant poisoning. Coming to question number 69, neuromuscular blockade monitoring is done by testing which nerve in the upper limb? It is ulnar nerve. Straightforward question, it is ulnar nerve. Coming to the question number 70, patient presented with respiratory depression after ingestion of opioids. How will you manage? As all of you know, opioid toxicity can be present with this triad of features. This triad is pinpoint pupil, comatose condition. So comatose condition, pinpoint pupil, and respiratory depression. So this is usually classical triad of acute morphine poisoning, morphine or opioid poisoning. So this is classical triad. Other signs symptoms may be cyanosis, hypotension, shock, convulsion, eventually may lead to death because of respiratory depression or arrest. So what is the treatment of choice for this patient? Treatment of choice is naloxone, because IV preparation is available. This is actually opioid antagonist. This is pure opioid antagonist available in IV preparation. This is also opioid antagonist, but this is available in oral preparation. As it is an emergency, so you have to give some IV preparation. So the answer is naloxone, opioid antagonist, which competitively blocks opioid receptor and rapidly reverses the respiratory depression. That is why naloxone is used in opioid toxicity. So this is all about question number 61 to 70. In the next video, I am going to discuss question number 71 to 80. So stay tuned for the next video, and don't forget to subscribe the channel. Share the video with your friends, seniors and juniors. Thank you very much.